Hello everyone, Dr. Ernesto Medina here, founder of the Bay Area Health and Wellness Center in San Jose, California. Today I want to talk to you guys about the functional medicine and the clinical nutrition approach to mental health. This is a huge area in the conventional medical system that gets ignored, not talked about, and not addressed. And it's a huge piece as far as managing symptoms and improving recovery and decreasing reliance on a lot of these medications, these antidepressant, anti-anxiety medications. So I want to talk a little bit about that today. So we're going to focus our presentation largely on a few neurotransmitters. Now, neurotransmitters are chemicals in the brain that either decrease activation, increase activation, help with mood, sleep, enjoyment, pleasure, and help the brain just shut off at night so one can get restful sleep. Now, the main neurotransmitters we're going to talk about today are serotonin, dopamine, and GABA. And we're going to touch briefly on acetylcholine, but the majority of our talk is going to be based on the first three. And this is largely because most of the pharmaceuticals that exist today for psychiatric disorders and antidepressant and things like that are based around those main three neurotransmitters. So all your medications like Lexapro, Zoloft, Prozac, they're all considered serotonin reuptake inhibitors, meaning they try to increase the amount of those neurotransmitters, serotonin, in the brain. And then you have we'll talk more about the dopamine ones, but you have your other dopamine reuptake inhibitors like Wellbutrin being the most popular one. And then you have your GABA medications. These are your anti-anxiety benzodiazepine medications like Xanax and Valium. Clonazepam is another one. So most of the psychiatric medications revolve around those three main neurotransmitters. So let's talk about serotonin first. So some of the most common signs and symptoms of an issue with serotonin are decrease in pleasure of hobbies and interests, feelings of being overwhelmed all the time, or inner rage, or unprovoked anger. Even paranoia, feelings of constant paranoia or sadness for no apparent reason, and the inability to fall into deep sleep or restful sleep at night. Now, as far as how serotonin is made, we need a few key micronutrients. We need healthy iron levels. We need healthy B6 levels. We need magnesium, plenty of magnesium in the body. And interestingly enough, magnesium is the number 2 deficiency in the United States in Americans. We need healthy calcium levels and plenty of zinc in our system to just make serotonin at the base level. And then we have blood sugar and insulin spikes from eating the standard American diet of highly refined grains and carbohydrates and too much breads and pastas. Those insulin surges are highly inflammatory, but they also create fluctuations in serotonin levels. So, for example, those are those people who are highly addicted to carbohydrates and pastries and bread. I'm sure everyone knows someone who can't give up carbs, and through the same mechanism, it can create addiction to those foods. Now, with those basic micronutrients, we need cofactors. The primary cofactors being L-tryptophan and 5-HTP. Many people are probably familiar with 5-HTP and how you can take it as a supplement. A lot of people use it to help sleep, but it is a necessary cofactor just to make serotonin. But without the basic building blocks of iron and B6 and magnesium, we cannot even make serotonin. And then serotonin converts into melatonin, again, a sleep hormone that shuts off our brain at night. But in order to do that, we need more B vitamins and healthy levels of them in the blood. And then we have estrogen. Estrogen increases serotonin production in the brain as well. This is likely why women, during menstrual cycles and during certain phases of their cycles, can experience mood shifts and mood swings through the same estrogen surge mechanism, increasing or decreasing serotonin levels. This is also a possible mechanism for why birth controls or too much estrogen imbalance can lead into mood disorders and mood swings. So the important thing to note here is that with all these neurotransmitters, if we do not have the basic building blocks to make serotonin, we cannot, should we be put on a medication to try to increase its uptake when we lack the basic nutrients to even make it. Next, we're going to talk about dopamine. Common signs and symptoms of dopamine issues: feelings of worthlessness and hopelessness, inability to finish tasks or to focus on tasks. This is common in ADD and ADHD. Many of the medications used for those people are dopamine inhibiting dopamine uptake. Self-destructive thoughts, anger and aggression under stress, and feelings of isolation or wanting to isolate yourself from others. So, what are our basic building blocks of dopamine? Again, we have blood sugar and insulin surges, which can cause imbalance and fluctuations in our dopamine levels and dopamine production. Again, another possible mechanism for carbohydrate and sugar addictions. Protein levels, needing healthy protein levels in the blood, and optimal iron levels. And of course, we need our cofactor tyrosine. And in the world of dopamine, testosterone actually increases binding and production of dopamine. Now, let's talk about GABA. Common signs and symptoms of GABA deficiency: anxiety, nervousness, or panic. Think of GABA as your rest and relax neurotransmitter. When you're having issues with that, we can have massive issues with anxiety, issues with restless mind, unable to shut off the mind at night, feelings of overwhelmed and disorganized attention or thoughts, and feelings of guilt for no reason. Now, GABA, like I was mentioning before, is our inhibitory or turning off the mind neurotransmitter. It is made by another neurotransmitter called glutamate. Now, we're not going to talk much about glutamate other than it is one of our primary excitatory neurotransmitters. It gets things fired up and running in the brain. But we can have too much excitability, a term coined by a neurosurgeon, Dr. Russell Blaylock, called excitotoxicity, exciting brain cells to a point of death. So our system has to be able to convert that glutamate into GABA to shut it off. We need progesterone and healthy progesterone levels, which is a hormone commonly known as a female reproductive hormone, but males should have a decent amount of it too. Progesterone is vital for GABA production. And we have the adrenal glands. Adrenal glands are a little organ that just sits above the kidneys that helps produce progesterone. Also known as our stress glands. They secrete hormones to help manage stress. Again, we have glucose, and we need healthy glucose levels to create enough GABA. So, some of the signs and symptoms of issues with any of these mechanisms. If we have deficient functioning adrenal glands or low adrenal glands, we can commonly have signs of low blood pressure or chronically low blood pressure. We could crave salt throughout the day, or sweets even. We can have chronic cold hands, cold feet, and a cold nose throughout the day. And fatigue and dizziness with changing position or getting up too fast. Some of the other problems with glucose, we were talking about having too many highs or even too many lows of blood sugar. That's people who skip meals or don't eat often enough throughout the day. And we call that hypoglycemia or reactive hypoglycemia. Common signs and symptoms of this are people who crave sweets and carbs throughout the day or require coffee to get started in the mornings. If you're sleepy after meals or have a crash after meals, another sign of probable reactive hypoglycemia. Or the common term known as hangry, getting hungry and angry because you need food in your system. And then the other thing that can affect proper production or conversion of glutamate to GABA is something called GAD65 antibodies. Now, I won't talk too much about this other than this is an autoimmune issue. So you can imagine there can be an autoimmune component to chronic anxiety for many people. And needless to say, most psychiatrists, psychologists, primary care doctors are not evaluating this mechanism for people who suffer from chronic anxiety. And last but not least, we'll just touch briefly on this. Latest research is showing something called a brain-gut axis that exists, which means we have an intricate relationship between the brain and our digestive tract. One cannot function independently of the other. So the foods we eat and any irritating inflammatory foods we put into our digestive system will directly feed back into the brain and negatively affect the brain and can downregulate or upregulate a lot of these neurotransmitters we just talked about. Very important piece. Now I want to leave you guys with a couple of resources here. These are some of my favorite books. Why Isn't My Brain Working? Written by one of my teachers and mentors. And then this other great book called The Inflamed Mind just came out. I'm talking about the link between systemic inflammation and digestive inflammation and its effects on mood and mood disorders in the brain. Right? So just to close, again, my name is Dr. Ernesto Medina, founder of the Bay Area Health and Wellness Center in San Jose, California. We offer free 30-minute consultations if anyone would like to give us a call and see how we can help you. Contact info is on the bottom there. We look forward to hearing from you. Thank you.